So my name is Duvall. We're going to be talking about carpal tunnel syndrome today. So what carpal tunnel syndrome is pain in a median nerve that runs from C5 of the vertebrae to C8, which is about halfway down the neck, through thoracic 1, and it comes down in the middle of the arm, and then goes to the first, second, and third phalange. The carpal tunnel is in the palm side of the wrist. The median nerve goes through it. It's about right here. It's in between. It's in the middle of the carpals, and it houses the median nerve, tendons, and some muscles. And so whenever people get carpal tunnel syndrome and they start feeling pain in their hands and in their fingers, it's because that median nerve has become compressed, or the muscles and tendons around it have become inflamed, and it's pinching against that median nerve. So you can either feel numbness, you can feel tingling, or you can feel pain, or even weakness. So sometimes people will become clumsy and drop things whenever they get carpal tunnel syndrome. And then just a fun fact, women are 3 times more likely to get carpal tunnel syndrome because of the size of the median nerve in the female wrist. So the mechanism of injury is repetitive motions with the hands throughout the entire day, such as typing or playing on the piano or playing an instrument, and also carpentry and any kind of repetitive motion with the hands that you're doing all day long. So first we're going to go into some palpations. We're going to do the bony palpations first, and we're going to check the radial styloid process. And so I'm going to have the athlete shake hands with me, and I'm going to point the wrist inward and down. You can feel it's the bony process right here. So is there any pain with that? Yes. Okay, so there's pain with that. We're also going to check the anatomical snuff box. So if you just try to point your thumb as high as you can in the air, and it's not very prominent on this athlete in particular, but it's normally right here. We're going to check the pisiform. So after you flex, and that's right here. Is there anything with that?
Yeah.
Yes. Okay. The third metacarpal phalangeal joint, which is, so you go first, second, third, and then it's the knuckle. Phalangeal joint right there. Is there any pain with that?
Yes.
Yeah, that one as well. Okay. And so we're going to have a soft palpation, which is the thenar eminence, which is this muscle here. And you just palpate there. Does that hurt?
Yes.
Yes, so there's pain with that. And so I did these particular palpations because the radial, or the median nerve runs and it innervates the thumb, the pointer finger, and the middle finger. And so it's going to affect motions with these 3 fingers. So we're going to go ahead and go into some special tests. We're going to first do the Phalen's test. And what that is, so the athlete is going to flex both of her wrists like this and allow them to hang down. But the best way to do that is actually have her come off the bench and sit in a chair. And we're going to have the athlete do that same motion and put their elbows on the table. And we're going to do this for a total of 2 minutes. And so we're going to see if it becomes tingly, or if it becomes painful, or so on and so forth. If somebody does not have carpal tunnel syndrome, they can do this for up to 10 minutes and still not feel any kind of sensation. An athlete who does have this is going to feel numbness or tingling within 1 to 2 minutes. And so, are you experiencing any pain, any discomfort? Okay, we'll give it another 30 seconds or so. Any pain yet? Yes. Okay. Yeah. So we have some discomfort with that. Normally, it's not going to exactly be pain. It's going to be a tingling sensation, like your hands have fallen asleep, or It's kind of like pins and needles sensation, you could say. And so the reason we rest the elbows is to take out any of the other muscles from the equation, the biceps, the triceps, the forearm, anything like that. We're going to take that out of the equation, and we're just going to focus on that median nerve. And so you can go ahead and sit back up here. And so another special test that we're going to run through is called the Tinel's sign. And so what we're going to do with that is you locate the median nerve roughly where it's going to be at, and it's going to run through just right through the middle of that palm, and you're just going to tap on it. And that percussion is going to cause a pain or some kind of sensation in the athlete's wrist if they do have carpal tunnel syndrome. And so that's what we're going to do right now. Any pain with that? Okay, let's try this one. Yes. Any pain with that? Yes. Or some kind of sensation with that? Yeah. Okay. And so now we're going to do the Allen's test, which is checking for circulation. What we're going to do is have the athlete squeeze their wrist. We're going to cut off essentially all circulation, and we're going to hold that for 30 seconds. So just make a fist. You check it. You're cutting off the radial and ulnar nerve. Ulnar and radial artery, excuse me. Okay, and then we're going to let go and undo your fist. Okay, and then the color should come back within 7 seconds. Because it didn't, that's a positive sign of carpal tunnel syndrome. And another special test that we can run through is called opposition. It's more of a range of motion special test, whichever you could like to classify it as. And so, because again that median nerve does only innervate the first three fingers, so we're just going to have you touch your pointer finger and your middle finger to your thumb. You can't do that, right? So because you can't do that, that shows that there's weakness in the pointer and the middle finger, and that indicates, again, a positive sign for carpal tunnel syndrome. So now we're going to go into some actions of how to kind of treat for carpal tunnel syndrome. And so one of the first things that we can do is do a wrist flexor stretch. And so you hold out your arm, and then you point your fingers down to the ground, and then you take your other hand, if you can, sometimes it'll hurt, sometimes the athlete can't make it this far, and you push backwards towards your body as far as you can, and allow that to stretch. Hold that for about 15 to 30 seconds. So you can do both of them, and we're going to do this 2 to 4 times, hold it for about 15 seconds each. And this is just getting a good stretch in the forearm and allowing that median nerve to stretch out. Again, we're going to hold it for about 15 to 30 seconds each. Okay, so now we're going to go on to the next treatment. So we're going to use a TheraBand. So this is just a stretchy band. This is going to help with both range of motion and strength. And the way we're going to do this is we're going to hold both ends of it. I'm going to hold both ends of it while the athlete tries to just flex the wrist. So let's see. Go ahead and put your arm here. So we're going to do this about, so you can, these are a bit bulky, and so you can essentially just cut them in half. That does make them a little bit stronger. But, and so you're going to have the athlete, place that right about on the palm, and have the athlete just flex their hand. We're going to do this about 10 times. And you want to try to keep that forearm down to really get a good stretch. So, so after we use the TheraBand, this is again a light TheraBand. If it's too easy for the athlete, you're going to want to progress and use something a little bit different. You can use the medium or the heavier, but that's a good rehab tool for carpal tunnel syndrome. Another good stretch is called the prayer stretch. And so what we're going to have the athlete do is just put their hands together, stick their elbows out, keep their thumb really close to their body, and just push down into their sternum. And if this is too painful for them, or the TheraBand's too painful for them, then we can go back up and do the wrist flexor stretch, or do something a little less intense. And there's another stretch called the spider mirror stretch, where they put the fingertips together, and then they use their fingertips to push off, curl their fingers up, and let go, and curl their fingers up like this. And they can do that 5 to 10 times, and that's a little bit easier of a stretch. And then we have another stretch where they can stick their arms out, make a fist, squeeze it tight for 10 seconds. So we're squeezing that really tight for 10 seconds. And when that 10 seconds is up, they're going to release their fist and stretch out their fingers as far as they can go. And we're going to do that about 5 times. And holding your fist in for 5 to 10 seconds. And stretching that out really far. Okay, good. And so whenever the athlete has progressed through this, again, it's going to be a progression. So maybe the first day they come into the treatment room, they're going to be in a little bit more pain, and they're not going to be able to use things like the TheraBand or maybe even get into some of these stretches. And so we're going to just focus on some of the range of motion stretches and just the really light, non-weight bearing stretches, I guess you could say. And then once we get farther down into the progression and farther into rehab, then we can start using weights. This is just a 2-pound Weider weight. It's just a little dumbbell. And so we're going to give it to the athlete. I'll demonstrate it first. So we're going to do a wrist flexion. And so they grab onto the dumbbell, and then they just flex it up, and then they can flex it down. Flex it up, and then flex it down. You want to keep that, keep the forearm straight and keep the elbow right at a 90-degree angle. This is really going to focus on strength. Yeah, and we can do that about 5 times. And we want to do both because this is not only a rehab mechanism for carpal tunnel syndrome, this is also a way to prevent carpal tunnel syndrome. And so after we've gone through the rehab process, after we've worked out the muscles and we've done these things, we want to ice it down for about 15 minutes because, like I said before, the median nerve that is causing this pain is actually being inflamed, or the muscles around it are being inflamed, and they're pinching on the median nerve. And so if we can get rid of some of that inflammation and swelling, we can cause the tension on the median nerve to be released. And so there's a couple different ways that we can ice it down. We can do either a ice massage, or we can do a bag of ice. So those are some good ways to do that. We can ice it down for 15 minutes after we've done these exercises. And then we'll go into a plan for what the athlete can do at home without us. Again, the athlete can go through all of these exercises and all these stretches because they're just stretches that we've put them through. So the best course of action for them is to just rest their wrists, to rest them for at least 2 weeks, just to give the wrists some time to heal. They want to avoid all activities using the hands. So if they're musicians, it's going to be tough, but they have to learn to just not play music for a little while and let their body heal. We also want to immobilize the wrist. We can do this either by splinting it, by taping it, any means necessary just to immobilize the wrist and keep it from moving to create further damage and further inflammation and causing even more pinching on the median nerve. And again, they want to ice the wrist even further when they're at home. Ice it as much as possible. If the pain comes back, just keep icing it. If the tingling sensation comes back, that's when we want to stretch it and do the things that we talked about today. And they also can take non-steroidal anti-inflammatory drugs like ibuprofen, something like that. Also, it will help with the pain and it will keep the swelling down. And then there's a few things that you just try to get them to focus on when they're typing. Have them lift up on the wrists instead of down and being lazy and typing. And there's wrist pads for that they can get for their computers. Tell them to get off Facebook quite so much, all that typing on their phones, it's no good for them. And if they're a musician, just try to get them to relax the wrist, put a splint on it, and so that's what we can do for this issue. So, thanks.